Hello, I'm Dr. James Wilson and welcome to Senior Vitality Clinic. Today I'm going to help you understand blood pressure numbers so you can have better conversations with your healthcare team. Here's something that might surprise you. About half of American adults have high blood pressure, but many don't fully understand what those numbers mean. I see this in my practice every single day. Patients tell me, my top number was 138, or the nurse said my bottom number was high, but they're not sure what that actually means for their health. Today, we're going to change that. By the end of this video, you'll know exactly what your blood pressure numbers mean. You'll understand why doctors care so much about them. And most importantly, you'll know which questions to ask at your next appointment. We'll cover what the top and bottom numbers actually measure, the difference between normal, elevated, and high blood pressure, why blood pressure changes throughout the day, what puts you at risk after age 60, specific questions to ask your doctor. This isn't about scaring you. It's about giving you the knowledge you need to take charge of your health. So grab a pen and paper because you'll want to write down some of these key points. Let's get started. Why blood pressure matters. After 60. Let me start with the basics. Your blood pressure is one of the most important numbers in medicine. According to the Centers for Disease Control and Prevention, high blood pressure is called the silent killer because it often has no symptoms, but it significantly increases your risk of heart attack and stroke. Here's what makes this especially important for people over 60. Your risk of developing high blood pressure goes up dramatically as you age. The American Heart Association reports that about 2/3 of adults over 60 have high blood pressure. That's not because you did anything wrong, it's because your blood vessels naturally become stiffer as you get older. The common misconceptions. Let me address 3 things I hear in my office almost every week. Misconception, number 1. My blood pressure is fine because I feel fine. This is dangerous thinking. High blood pressure rarely causes symptoms until it's already damaged your organs. You can feel perfectly healthy and still have dangerously high blood pressure. That's why regular monitoring is so important. Misconception number 2. The top number is the only one that matters. Both numbers are important. They tell us different things about your heart health. We'll get into the specifics in just a minute. Misconception number 3. Blood pressure medicine is just for old people. Actually, people of all ages can need blood pressure medication. But yes, the risk does increase with age. The good news is that medication has come a long way. Modern blood pressure medications are effective and most people tolerate them very well. What your blood vessels are doing right now. Think about your circulatory system like a garden hose. When water flows through a flexible, healthy hose, the pressure stays steady. But what happens when that hose gets older and stiffer? The pressure increases. Your blood vessels work the same way. Every time your heart beats, it sends a wave of blood through your arteries. When you're young, your arteries are flexible and can expand a bit with each heartbeat. As you age, they become stiffer. This is called arterial stiffening, and it's one of the main reasons blood pressure increases with age. The National Institute on Aging explains that this stiffening happens to everyone, but the rate varies. Some people's blood vessels stay relatively flexible into their 80s and 90s. Others experience significant stiffening in their 50s and 60s. Why this affects your brain, heart, and kidneys. Here's what happens when blood pressure stays high for months or years. Your heart has to work harder to pump blood. Over time, the heart muscle can thicken and weaken. Your arteries develop small injuries on their inner walls. These injuries can become sites where cholesterol builds up. Your kidneys, which filter your blood, can become damaged. They need proper blood flow to work correctly. Your brain's small blood vessels can be damaged, which increases the risk of stroke and may affect memory and thinking. According to research published in the Journal of the American Medical Association, controlling your blood pressure is one of the single most important things you can do to reduce your risk of heart disease and stroke, especially after age 60. Now that you understand why blood pressure matters, let's talk about what those numbers actually mean. Understanding the 2 numbers. When you get your blood pressure checked, you see 2 numbers. Let's say it's 130/80. We write it as 130/80. What does each number mean? The top number, systolic pressure. The first number, 130 in this example, is called your systolic blood pressure. This measures the pressure in your arteries when your heart beats and pushes blood out. Think of it this way. When your heart squeezes and pumps blood, that creates the maximum pressure in your blood vessels. That's your systolic number. This number tends to go up more dramatically with age than the bottom number. That's because of the arterial stiffening we talked about earlier. The bottom number, diastolic pressure. The second number, 80 in our example, is your diastolic blood pressure. This measures the pressure in your arteries when your heart is resting between beats. Even when your heart isn't actively pumping, there's still pressure in your blood vessels. Your diastolic pressure tells us what that resting pressure is. In people under 50, doctors often pay more attention to the diastolic number. But after age 60, the systolic number becomes more important as a predictor of heart disease risk. This information comes directly from the Framingham Heart Study, one of the longest-running heart health studies in the world. What do these numbers mean in millimeters of mercury? You might hear your doctor say millimeters of mercury or see mmHg written on your blood pressure readings. Don't let this confuse you. Blood pressure is measured in millimeters of mercury because the original blood pressure devices used a column of mercury that would rise and fall. Modern devices don't use mercury anymore, but we still use the same measurement system. When your blood pressure is 130/80, that means the pressure in your arteries could push a column of mercury up 130 millimeters when your heart beats and 80 millimeters when it's resting. The blood pressure categories. You need to know the American Heart Association and the American College of Cardiology updated the blood pressure guidelines in 2017. Here's what they currently recommend. I want you to pay close attention to these categories. Normal blood pressure. Top number, less than 120. Bottom number, less than 80. Example, 115/75. If your blood pressure is in this range, that's great. Keep doing what you're doing. Your doctor will probably want to check it again in a year. Elevated blood pressure. Top number, 120 to 129. Bottom number, less than 80. Example, 125/78. This is a warning sign. You don't have high blood pressure yet, but you're heading in that direction. This is the time to make lifestyle changes. Talk to your doctor about steps you can take to prevent it from getting higher. High blood pressure. Stage 1. Top number, 130 to 139. Bottom number, 80 to 89. Example, 135/85. This is where treatment usually begins. Depending on your other risk factors, your doctor might recommend lifestyle changes, medication, or both. People over 60 with other health conditions often need medication at this stage. High blood pressure. Stage 2. Top number, 140 or higher. Bottom number, 90 or higher. Example, 145/95. This definitely requires treatment. Most doctors will prescribe medication at this level, along with lifestyle recommendations. The risk of heart attack and stroke is significantly higher when blood pressure reaches this stage. Hypertensive crisis. Top number, higher than 180. Bottom number, higher than 120. Example, 185/125. This is a medical emergency. If your blood pressure is this high, call 911 or get to an emergency room right away. Don't wait to see if it comes down on its own. Talk to your doctor about which category you're in and what it means for your specific situation. Why your blood pressure changes throughout the day. Here's something that confuses a lot of people. Your blood pressure isn't a fixed number. It changes throughout the day based on what you're doing. Your blood pressure is typically lowest when you're sleeping. It starts to rise a few hours before you wake up. It's usually highest in the middle of the day and starts to drop again in the evening. This is completely normal. It's called your circadian rhythm, and your body is supposed to do this. Your blood pressure also goes up when you exercise or do physical activity, feel stressed or anxious, drink coffee or caffeine, smoke or use tobacco, eat a large meal, need to use the bathroom, feel pain, are in a cold environment. It can go down when you rest or sleep, take certain medications, are dehydrated, though this can be dangerous, have just eaten. Some people experience a temporary drop. According to the Mayo Clinic, it's normal for blood pressure to vary by 10 to 20 points throughout the day. That's why doctors don't diagnose high blood pressure based on a single reading. They want to see a pattern of high readings over time. The white coat effect. Have you ever noticed that your blood pressure seems higher at the doctor's office than at home? You're not imagining it. This is called white coat hypertension, or the white coat effect. Research published in the New England Journal of Medicine shows that about 15 to 30% of people have this. Your blood pressure goes up simply because you're in a medical setting. You might feel a little nervous or anxious, even if you don't realize it. This is one reason why home blood pressure monitoring has become so important. It gives your doctor a more accurate picture of your typical blood pressure. Talk to your doctor if you think you might have white coat hypertension. They can help you monitor your blood pressure at home. Special considerations for people over 60. After age 60, a few unique factors come into play. Fight or pulse pressure. Pulse pressure is the difference between your top and bottom numbers. If your blood pressure is 150/70, your pulse pressure is 80, 150 minus 70. As you age, it's common for this gap to widen. Your top number might go up while your bottom number stays the same or even goes down. A pulse pressure over 60 is associated with increased risk of heart disease in older adults, according to research from Johns Hopkins Medicine. Orthostatic hypotension. This is when your blood pressure drops suddenly when you stand up. You might feel dizzy or lightheaded. This becomes more common after age 65 and can increase your risk of falls. If this happens to you, mention it to your doctor. They may need to adjust your blood pressure medication or check for other causes. Morning surge. Some people experience a rapid increase in blood pressure in the early morning hours. This morning surge is associated with increased risk of stroke in older adults. If you're monitoring your blood pressure at home, taking a morning reading can help identify this pattern. Target blood pressure for older adults. Here's where things get a bit more complicated. The ideal blood pressure target for people over 65 has been debated in the medical community. The SPRINT trial, published in the New England Journal of Medicine in 2015, found that lowering systolic blood pressure to less than 120 reduced the risk of heart attack, stroke, and death in people over 50 with high blood pressure. However, the American College of Physicians recommends a target of less than 150/90 for most people over 60. They argue that very low blood pressure can increase the risk of falls and other problems in older adults. Your doctor will work with you to find the right target for your situation. Factors they'll consider include your overall health, other medical conditions you have, medications you're taking, your risk of falling, your lifestyle, and preferences. This is why regular conversations with your doctor are so important. Your ideal blood pressure target might be different from your neighbor's. What raises your risk? Let's talk about risk factors you should know about. Some you can change, others you cannot. Risk factors. You cannot change. Age. Risk increases after 60. Family history of high blood pressure. Race. African Americans have higher risk. Chronic kidney disease. Risk factors. You can change. Being overweight or obese. Not getting enough physical activity. Eating too much salt. Drinking too much alcohol, smoking or using tobacco, not getting enough sleep. Chronic stress. The good news? According to the National Heart, Lung, and Blood Institute, lifestyle changes can lower blood pressure by 10 to 20 points or more. That's often enough to move you from the medication-needed category to the lifestyle management category. Talk to your doctor about which risk factors apply to you and which ones you can work on changing. What you can do. Starting today, let me give you specific, actionable steps you can take right now. Step 1. Know your numbers. Write down your blood pressure from your last doctor visit. If you don't know it, call your doctor's office and ask. You have a right to know your health information. Keep a record. Write down the date. Your blood pressure reading. What time of day it was taken. Any symptoms you were having. Step 2. Consider home monitoring. If you're over 60 or have elevated blood pressure, ask your doctor about monitoring at home. Home blood pressure monitors are affordable, usually between $25 and $75. Look for a monitor with an upper arm cuff, not a wrist cuff. Upper arm monitors are more accurate. Make sure it's been validated for accuracy. The American Heart Association has a list of validated monitors on their website. When you measure at home, sit quietly for 5 minutes first. Don't talk during the measurement. Keep your arm supported at heart level. Take it at the same time each day. Take 2 or 3 readings, 1 minute apart. Step 3. Questions to ask your doctor. Write these down and bring them to your next appointment. 1. What is my current blood pressure, and what category does it fall into? 2. What should my target blood pressure be, given my age and health conditions? 3. How often should I be checking my blood pressure? 4. Would you recommend a home blood pressure monitor for me? 5. Are there any lifestyle changes that could help lower my blood pressure? 6. If I need medication, what are my options and what are the side effects? 7. How will we know if my treatment is working? 8. Should I be concerned about my pulse pressure, the gap between the two numbers? 9. Do I have any symptoms of orthostatic hypotension, dizziness when standing? 10. How do my other medications affect my blood pressure? Step 4. Prepare for your appointment. Bring your blood pressure log if you've been monitoring at home. This information is incredibly valuable to your doctor. Make a list of all medications you're taking, including over-the-counter drugs and supplements, any symptoms you've been experiencing, questions you want to ask. Step 5. Resources and support. The American Heart Association has excellent free resources at heart.org. They offer blood pressure tracking sheets, information about medications, lifestyle modification guides, support groups. Your local senior center may offer free blood pressure checks. Many pharmacies also provide this service. The National Heart, Lung, and Blood Institute, part of the NIH, has patient education materials available at nhlbi.nih.gov. Remember, always discuss any changes to your health routine with your doctor before making them. What works for someone else may not be right for your situation. Let's recap what we've covered today. Blood pressure is measured with two numbers. Your systolic pressure, the top number, measures the pressure when your heart beats. Your diastolic pressure, the bottom number, measures the pressure when your heart rests. Normal blood pressure is less than 120/80. Elevated blood pressure is 120/129 over less than 80. High blood pressure starts at 130/80. Your blood pressure naturally changes throughout the day. That's normal. What matters is the overall pattern over time. After age 60, your blood pressure becomes even more important to monitor. The risk of heart disease and stroke increases, but controlling your blood pressure can significantly reduce that risk. The most important thing you can do is have informed conversations with your doctor. Ask questions. Keep track of your numbers. Take an active role in your health care. Remember, every person is different, and what works for one person may not be right for another. Always discuss any changes to your health routine with your doctor before making them. If you found this helpful, subscribe for more evidence-based health education. Next week, we'll be talking about cholesterol numbers and what they mean for your heart health. Thanks for watching, stay healthy, and I'll see you in the next video.